When we look at the science of how we think and how we feel and how we actually make decisions on how to act, it's very helpful to have a basic science understanding of what those feelings, thoughts, and actions are really all about and how they interact with each other. If you're someone working in a field of helping others, knowing your own internal state, for example, how anxious you might feel or how much fear you might be experiencing, is extremely important because our inner states of mind, the overall way in which our mind is organizing itself, is governed in part by the emotions that we feel. An emotion can be thought of as something that evokes motion, and one of the emotions is fear, another is anger, another might be sadness. Those are sometimes called, in quotes, negative emotions, meaning they constrict us, and they're often generated in reaction to a feeling of being threatened. And those are contrasted to a set of emotions sometimes called, quote, positive emotions, which are a feeling of awe, joy, love, elation. These positive emotional states, instead of the constriction of negative states, in the positive states, they're open, what one researcher calls they broaden and build our experience. So this understanding of negative constrictive emotions and positive expanding emotions is a very helpful place to start. Now let's talk about the science of the mind so we can understand why knowing about your feelings and knowing about the feelings of others is so profoundly important. So here's a way to think about it. We have the inner subjective experience of life that we're going to call the mind. So you may feel right now curious about what I'm about to say, and that feeling of curiosity, the texture of curiosity, is a mental experience. So we're going to use the word mind for that. You also have your brain. The brain is a part of the overall body that sits up in your head, and it can be described as being composed of basic cells called the neurons, and these neurons interact with each other by communicating with electrical signals and chemical release. Those two states, reactive with threat, receptive with being at ease and open, are two states that the brain is creating. And when we get into the systems in the brain, which we'll do right now, it's going to help you because what you do with your understanding can actually change how this brain works. If we're working, let's say, with the Ebola crisis or any kind of challenge to people's health or lives or well-being, then understanding the brain is going to give you an inner strength to be able to not only take care of yourself, but actually take care of others more effectively. So let's dive into this brain and see how that happens. The spinal cord in your backbone brings up information along with other areas to the brain stem. Sitting on top of that is the limbic area, and on top of that is the cortex in your head like this. What do each of those areas do, and how do they relate to how you deal with stressors? So if we lift our fingers up and our thumb up, the brain stem is a part of the brain that not only helps regulate our heart rate, our respiration, and our gastrointestinal system, our digestion, but it also has neurons that are a part of a very important reactivity state when we're threatened. And that includes, in English, 4 F's. The first F is we want to fight back. So if something's threatening us, we want to fight. Second F is flee. We can be so flooded with fear that it's driven for us to run away, to flee. The third F is freeze. So the brainstem can create a tightening of our muscles and we literally cannot act. We're immobile. And the fourth F is faint. Some people call this feigning or faking death. Now the question about why fear is so important to understand is not only about this aspect of the reactivity of the brainstem, but if you put your limbic area down and we notice that this is sitting on top of the brainstem, this is called the old mammalian brain. There are many functions that are subserved or carried out by the limbic area. One is that it works very closely with the brainstem and the body to create emotion. So if we ask the basic question, what are we feeling emotionally, we're really asking, what are we aware of that's being generated from our limbic area, our brainstem, and our body. The limbic area also works very closely with the brainstem to motivate us. So if you see someone's motivation to try to interfere with healthcare workers, for example, in a community, we need to understand that it's driven by their limbic area and their brainstem. Motivation, in many ways, is what channels the emotion into action. And so motivation and emotion work together. A third limbic function, also important at a period of crisis, is called appraisal. The other word sometimes used is evaluation. This region evaluates, first of all, are things that are happening in the world, in the environment, are they important? Should I pay attention to them? The second phase of evaluation is to say, is this thing I'm paying attention to important or not important? The next phase of this is to say, okay, if this is important, is it good and how do I get more of it? And if it's bad, how do I get less of it? So there's this unfolding of evaluation. So you can see that the appraisal system, let's say of someone in the community facing an epidemic, becomes very important if they are evaluating issues that you're trying to teach them as unimportant, then they will not pay much attention to it. Or if they think it's bad what you're saying, they'll pay attention, but then they'll try to push it away. Finally, there are memory systems and attachment systems. This fourth function, memory, is basically how you draw on deep sources of remembering things, which can be different from our usual factual memory or autobiographical memory. They can be literally embedded in the feelings in our bodies, the emotions that we have, just the tone of a perception. And so these are called implicit layers of memory, and they get woven together into these larger frames of memory by an area of the limbic region called the hippocampus. How people respond to public engagement, let's say about the Ebola crisis, will be shaped in part by how they're not only evaluating things, but how their memory system is encoding those things. And then finally, attachment. Attachment we have as mammals. And what it means is that we rely on our caregivers when we're young, but on our peers and friends and close family members when we're older, so that when we're distressed, they help soothe us, we feel trust in them, and we rely on them to help us manage through life. Attachment becomes very important when it comes to community engagement around epidemics, because if everyone is fearful and mistrusting the medical workers that come in, then their attachment systems will not embrace you as a medical professional as someone worthy of being trusted. So in their state of distress, they won't be turning toward you. In fact, they'll turn away from you. Next, we have the cortex. So if you bend your fingers over the top, this area of the brain is very important for making decisions. The back of it basically makes maps of the outside world. The top part helps map out where the body is, the side for sound. And the front area, from your second knuckles forward, allows you to think through things. The front of the front, your last knuckles down to your fingernails, will be right behind your forehead. This is a part that integrates everything together. So 5 independent things, cortex, limbic area, brainstem, body, and the social world are all brought together by the frontal area, especially the front of the front, the prefrontal cortex. When you have fear, what it does is it pushes upward from the brainstem and the limbic area, with the body generating fast breathing, and it moves up into the cortex and tells the cortex something bad is about to happen. Something bad, be wary, be vigilant, don't trust, don't trust, don't trust. And that's a cortical thought driven by all the appraisal and fear looking for danger that's being pushed up by the motivation of the brainstem and the limbic area and generated by the emotions of the limbic area, brainstem, and body. So you can see where these subcortical influences will shape how you think, how you work through problems, how you reason, and how you carry out action. And it's for these reasons that we as professionals need to know what's going on inside of us and learn to manage those states so we can become receptive rather than being reactive.